Hello friends, welcome back to the fourth video of my Udemy course Solid Waste Management. This video will give you idea about the biomedical waste. Biomedical waste is also the part of solid waste, but it is divided into the another category because if we cannot dump this biomedical waste with the general solid waste, because this biomedical waste consists of some infectious material or some infected material of patients having dangerous diseases. That's why this biomedical waste is separated in the another category other than the solid waste. Generally, the biomedical waste is any solid, fluid, or a liquid waste, including its container and any intermediate product which is generated during the diagnosis, treatment, or immunization of human beings or the animals. In research pertaining thereto or in the production or the testing of biologicals and the animals waste from the slaughterhouses or any other like establishments. This environmentally sound management of the medical waste requires a proper understanding of risk associated with the disposal of such a waste and methods for the proper segregation, storage, handling, and treatment and the disposal. This biomedical waste includes bandages, syringes, gloves, drugs, and the blood contacted supplies, etc. Sources of biomedical waste are general waste, that is all non-hazardous hospital waste similar in nature to the domestic waste. Next, syringes. These syringes includes the hypodermic needles, syringes, scalpel blades, blood specimen tubes, pasture pipettes, and the broken glasses that have been exposed to the infectious agents. Next source of biomedical waste is culture and stocks of infectious agents and associated biological, and this consists of specimen cultures from the medical and the pathological laboratories, or the culture and stock of infectious agents from the research and industrial laboratories, and the waste from the production of biologicals and the discarded live and the attenuated vaccines, culture dishes, and the devices used to transfer the inoculate and the mixed culture. Next source is bulk human blood and the blood product. This consists of human blood product of blood, items saturated and with the potential for the dripping of blood, serum, plasma, and other blood components, including the soil waste. Next source is pathological waste. This consists of the human tissues, organs, body parts, and body fluids that are removed during the surgery and post-mortem procedure, with the exception of teeth, feces, excreta, and the corpses and the body parts intended for the interment or the cremation. Next source of biomedical waste is isolation waste. This consists of the waste contaminated with the blood, excretion, exudates, or the secretion from the sources, isolated to protect others from highly communicable infectious diseases. Next source is animal waste. This animal waste consists of contaminated animal carcasses, body parts of animals, fluids, and bedding of animals that have been exposed to infectious agents during research and the production of biological or testing of pharmaceuticals. And the next source is a radioactive waste, and this radioactive waste consists of administering radiopharmaceuticals and the performing nuclear medicine procedures and the radioimmunology procedures, and the material which is coming out through this procedure consider in this radioactive waste. Then anti-neoplastic, or we can say the cytotoxic drugs, This is also the source of biomedical waste, and this consists of trace contaminated material and contaminated human excreta, which is a cytotoxic chemical, and it is hazardous pharmaceutical used in the chemotherapy, which in addition to being toxic are mutagenic, or we can say teratogenic when discarded or spilled. And the next source is chemical waste. Chemical waste consists of the waste which shows the ignitability, corrosivity, radio uh, activity or reactivity, or the ability to produce a toxic leachate in the landfill. Such a waste come under this chemical waste. So these are the different sources of biomedical waste. This biomedical waste is classified in the 8 main categories, that is, one is radioactive material, second is pharmaceutical material, third one is a chemical waste, fourth one is a gas containers, fifth one is toxic substances, sixth one is sharps material, means like syringes, etc. Then the human organs, from the operations, the human cutted human organ comes under this category, and the infectious waste, this one is the 8th classification of this biomedical waste. Next is a segregation, storage and transport of biomedical waste. These three things for the biomedical waste is very necessary, means the segregation of the biomedical waste in the different categories according to their sources, and after that the storage of this biomedical waste, and there is a proper method is followed for the transport of this biomedical waste, because we cannot mix general solid waste into this biomedical waste, because this biomedical waste is most infectious. In the segregation of waste, it is actually the most important aspect in the process of waste management. It allows the special attention to be given to the relatively small quantities of waste, and thereby reducing the risk as well as cost of handling and the disposal. For the purpose of segregation, the biomedical waste can be broadly classified into the categories, like first category is general or non-hazardous, or we can say the non-infectious material. This non-hazardous, non-infectious material should not be contaminated by the blood, body fluid, or other infectious agents or the materials. And this include paper, fabric, glass, food residues, containers, etc. And they do not require any special treatment like the other infectious material. And the second classification of the segregated material is infectious or hazardous medical waste. This kind of material can be properly segregated because this is a infectious material and it is necessary for efficient and economic treatment and disposal. They are mainly the waste which is potential to transmit the infection, and the waste which are having a properties of toxicity and the low level of radioactivity. And this kind of waste consists of, or it include body parts and the body fluids, or we can say the infectious material, or contaminated with the um, patient's blood. Next part of this video is storage of waste. We have seen the segregation. After the segregation of biomedical waste, we store that biomedical waste, and there are specific methods are available for the storage of this waste. This segregated waste of different categories need to be collected in the identifiable containers. Plastic bags for sorting the waste must be placed inside a sturdy container to avoid the infection or to avoid the unhygienic conditions. It should be provided in each room, and the label of that room must provided on the container. Means in each patient room there is a special provision of the different colored container in which this biomedical waste is stored. For storage of different types of waste, the color coding and the types of container have been proposed by the Ministry of Environment and the Forest. In this diagram, you can see there are different colored dustbin are shown, and these colored different color have a different material storage capacity. So you can see this black plastic container is there. In this black plastic container, generally non-infected waste or the cytotoxic drug and the chemical waste is stored. In red plastic container, and yellow and blue and white, these four colored containers are used for the infected waste, and in that, in this red plastic container, solid waste which is infected with the um, blood or other things like the dressing, popcast, etc. have been stored in this red plastic container. In yellow plastic container, anatomical waste like the placentia, pathology waste, and the body parts are stored. In the blue plastic container, infected plastic and the syringes and the gloves and the plastic waste is stored. And in the white plastic container, sharps, needles, and the cut glasses are stored. And this color coding for the biomedical waste storage is given by the Ministry of Environment. And the material which is stored in this black plastic container is chemically treated, or it is disposed by the method of land filling. The biomedical waste which is stored in this red plastic container is autoclaved, and after that it is buried into the earth. This biomedical waste which is stored in this yellow plastic container is sent to the landfill for the burial. Then the blue plastic container material is actually this is infected with the um, human blood cells. That's why the disinfection of this blue and white plastic container material is taken place with the help of the chlorine solution. This is the common treatment policy facility given for this different kind of biomedical waste. And this kind of color coding containers are used for the segregation of the biomedical waste. We have seen the segregation. After that we have seen the storage, and after storage of the biomedical waste, the transportation of biomedical waste takes place in the special vehicle. It should not be mixed with the general solid waste. They should never be transported with the general municipal waste, and this should be kept separate. The special vehicle should be used so as to prevent the access to and direct contact with the waste by the transportation operator, and they should be properly closed, and there should not be a leakage of such a material. And the driver should be trained in the procedure, and he must follow in case of accidental spillage. Thank you everyone for watching my fourth video of this Udemy course. Thank you once again.